Hi everyone, I'm Dale Smith, aka Journo Dale, and we're here to talk about Canadian politics. So this last week we saw a meeting of the federal and provincial health ministers, which wound up with the federal ministers walking out after a draft communique from the premiers was released before the meetings were even finished that declared the meetings were a failure, and the date on that draft was 5 days earlier, which essentially gave the notion that the premiers had set this meeting up to fail. And the minister basically said, the federal minister basically said as much, and said that, the premiers were standing in the way of the provincial ministers of getting work done. And it has kind of added up to a number of things that we've been seeing lately. And it's really making me wonder if we're seeing a pattern whereby the premiers are engineering a crisis in our healthcare systems as a way of strong-arming the federal government into transferring billions and billions of dollars over to them without any accountability or strings attached. And I figured I would just kind of play this out a little bit so that we can kind of get a grasp of what the situation is, because a lot of the reporting is not really going into some of the details that matter as to why things are happening the way they are. So with this in mind, I think it's important, first of all, to start off that most provinces have not been dealing with the crisis in their systems by properly funding aspects of it. And we're talking about increasing salaries for nurses and doctors who are leaving the system because they're burned out. They're not doing anything about ensuring that they're doing enough about the burnout, about other complaints that are in the system, such as violence against nurses in particular, who are dealing with particular patients. And they're also not doing things like reforming the way that family doctors build the system so that they are encouraged to stay in it, because the administrative burden has gotten so particularly cumbersome for them. Now, BC just in the last 2 weeks signed a new agreement with family doctors in the province that are going to reform the way that works. We haven't seen this really with other provinces yet, so maybe this is a hopeful first step, but these are things that provinces are supposed to be doing in order to fix the problems in the system, and they haven't been. And I think that's one of the first things we need to kind of start off on. There's also provinces like Ontario who legislated what is essentially a wage cut for nurses before the pandemic started, and it's still in place. And, the Doug Ford will talk about, well, they have a retention bonus for nurses, but that's not adding up to the same. We're in a high inflationary environment right now. Their wages are decreasing rapidly in that context. And the Ontario government is doing nothing about that. And that's a problem. And we also have to remember that Ontario underspent its healthcare budget last year, which is kind of hard to reconcile when you see the system is collapsing. We have emergency rooms that are closing on weekends because there simply aren't enough people in there. And they're not fixing the problems that are causing that. Instead, they're kind of patting themselves on the back for underspending. And that's a problem in the situation that we're in. We also have to remember that during the pandemic, the federal government sent billions of additional dollars to provinces in order to try and shore up those healthcare systems in light of the pandemic. And most of those provinces spent the majority of that money on their bottom lines in order to reduce their deficits or come in at a surplus, which means that money did not find its way into the system. And lo and behold, it's in crisis, it's collapsing. And while provinces are demanding more money from the federal government, they're kind of in a position where, like, we sent you money and you didn't use it for healthcare. And you have other provinces right now who are promising tax cuts. You have other provinces who sent checks out to everyone sometimes in advance of an election in order to basically buy votes. And when you look at this and the federal government looks at this and these provinces are still crying poor, it's not exactly showing that, they're hurting for cash that they could invest in their healthcare systems. And some provinces will use the excuse, well, this is just a one-time thing. We need ongoing funding for healthcare, but you're still sending the wrong message that you are doing things that are reducing your fiscal capacity while you are and crying poor and saying that you need the federal government to send you more money, but you have money in your own system for an area that is of your responsibility and jurisdiction that you should be investing in, and they're not. And this is partly what is creating this environment right now, and why I think the premiers are engaging in a fairly underhanded tactic. The other thing we absolutely cannot forget is that when healthcare transfers were rising at 6% per year for that decade, starting under Paul Martin and through most of Stephen Harper, while the transfers were rising at 6% per year, healthcare spending in most provinces was rising at an average of about 2.2%. So that means a lot of that money, billions of dollars, was being spent on other things. And that money was supposed to go toward transforming the system, and it didn't. Some provinces, managed to speed up some wait times around hip and knee surgeries and so on, but there was no system-wide transformation that this money was supposed to go toward. It shored up the status quo, and we are, again, back at a point of crisis because provinces didn't spend that money on the system when they had it, and now once again, the transfers have changed, so they're going up they're still going up every year, but at a slower pace. It's not 6% per year because that was unsustainable. It's more around 3%, although given GDP growth in the last 2 years, it is higher than that right now. But again, transfers are increasing. Provinces have not put that money into the system in a meaningful way, and we are in a state of collapse. So we're kind of at a point now where the provinces are crying poor and saying the federal government is underfunding us. Some of them are trying to say the federal government has cut funding or the proportion of funding is diminishing, and that's not really true either. They're using some math that obscures the fact that in 1977, it went from a 50-50 share to a 75-25 based on tax points. And, the federal share is well over over the 22% that the provinces are claiming right now. But this is a figure that they have arrived at somewhat dishonestly and are trying to use this as their public relations tool in order to basically shame the federal government into spending more money. And the federal government is saying, well, we can't just throw money at a broken system because that's not going to fix anything. And we want to ensure that the money is actually going to make improvements and not just let provinces reduce their own share of spending and keep things at status quo, which is collapsing, or turn it into things like tax cuts. And provinces have histories of doing this. Look at the so-called fiscal imbalance that Jean Charest convinced Stephen Harper the province was suffering. Harper gave them billions of dollars, which Jean Charest turned into a tax cut right away. That is kind of soured federal governments on trying to just hand money to provinces without anything attached. So the provinces are accusing the federal government of trying to centralize or micromanage, and that's not what is happening either. The federal government is looking for certain outcomes in terms of wait times, in terms of access to family doctors, in terms of hiring nurses and healthcare workers, in terms of standards for long-term care, for which they're trying to get a separate agreement. They are negotiating a separate agreement for mental health spending, which again has outcomes attached in terms of access to mental health professionals and that kind of thing. And the provinces keep saying, no, just send us money. Don't attach strings to it. But the federal government doesn't want to do that because we have seen repeatedly, including over the last 3 years, where if they just send the money, that money is not going into the healthcare system the way the premiers say it will. So they're kind of left in a position of, we want to make sure that there are outcomes to this money. The premiers keep saying, well, we want a meeting with the prime minister. The prime minister is saying, no, we want the health ministers to work out what the outcomes are so that we can work backwards and figure out how much money you need for us to send you to achieve these outcomes. But they're kind of at a bit of a stalemate right now. And what that is essentially meaning is that the provinces are spending money on misleading advertising and trying to claim the federal government is starving them of funds, which they're not. The funds keep going up. And the federal government is not efficiently pushing back and saying, you guys have a history of spending it on other things. We want outcomes. We want to make sure that this money is not going to a broken system. They have started saying that in the last few weeks. It's not been very effective, though, and that's a big problem. And also a problem is the fact that most media outlets are not actually fact-checking the province's statements. They're just repeating credulously that 22% figure, which is not true. And not bringing up the history of provinces spending federal healthcare dollars on things that are not healthcare, so that there isn't a level of trust for the federal government to say, if we send you this money, it will go towards healthcare, and then it doesn't. So that's kind of the situation we find ourselves in. And the fact that provinces are continuing to underfund and continuing to cry poor while running surpluses and sending checks out and so on is not exactly showing that they are acting in good faith. And it's making me wonder if they are letting this collapse happen as a way of strong-arming the federal government into just giving them the billions of dollars that they're asking for with no strings attached and hoping for the best. And I don't know that that's a sustainable way to run a federation, and it's not a sustainable way to run healthcare because it's been allowed to collapse and because we're not forcing a transformation onto a system that will actually do something to fix it rather than just, throwing money at a problem without actually fixing it. So this is kind of where we're at, and why I think we need to be very wary of what the premiers are doing. Now, there's little bits of hope here and there. BC did start reforming their billing and so on. Manitoba's premier appears to have blinked in this strategy and has now said she's going to throw another $200 million at her healthcare system in order to try and alleviate some of the problems. But the provinces are pretty steadfast in their misleading talking points about the federal government. The federal government is doing what they can, but this government cannot communicate their way out of a wet paper bag, and media is just credulously both siding this without actually doing the fact-checking necessary. So we're finding ourselves in a bit of a problematic situation, and I think we should just be aware of what the landscape is so that we're not just believing the fiction that, the federal government is starving them, because they're not. And we need to actually push the provinces, whose responsibility this is, to actually start fixing their messes so that, federal dollars are actually going toward fixing things and improving the system and ensuring that we get away from the state of collapse, which they're not doing. And that's everything for this week. Join us again next week for some more Canadian politics. I'm Dale Smith. That's at journo_Dale on Twitter. And don't forget to like the video, share, subscribe, and support us on Patreon. Thanks, everyone.